Okay, good afternoon, and thank you all for joining us today for a Zoom. NFWL is excited to be partnering with Pharma to bring you this critical information. In these unprecedented times, we are coming together to achieve one shared goal: to beat COVID-19. The decades-long investments Pharma has made in new technology, research, and treatments have prepared them to act swiftly. First, let me welcome NFWL's board member, Sharon Lamberton. She serves as the Deputy Vice President in State Government Affairs for Pharma, where she provides clinical expertise, policy support, and strategy for multiple industry-related issues. She won't be able to be on for too long, but we want to give her a quick moment to say hello, as she is a regular supporter, board member, and friend of NFWL. Before I turn it over to Sharon, let me also give an introduction for our main speaker, Courtney Christian. Courtney is a Senior Director of Policy and Research at Pharma, focusing on state-based reforms impacting health insurance, prescription drug coverage and public health programs, and on health equity. Prior to joining Pharma, she worked at the Black Women's Health Imperative as a Director of Policy and Advocacy, and on Capitol Hill for a number of years in a series of roles, including as Legislative Director. Courtney is a Florida State football fan and alumni, aspiring chef, and mom to an energetic preschooler. Let me turn this over to Sharon to get us started. I know I am looking forward to learning more about both of your work.
Thank you, Representative Scott. It is a pleasure to be here today, and I want to thank you for your kind introductions for both Courtney and I, and sending warm regards to Jody, Thomas, and Renee, and Brenna, and the incredible staff at National Foundation of Women Legislators. We have a great program for you today, and part of the program is to discuss all of the work that pharma, our industry, is doing to fight this horrible pandemic. As we see numbers continue to go up, we have good news because we have over 1,696 clinical trials for treatments and vaccines to date. And we have 2 of the front runners that are concluding phase 3 trials, meaning data will be done as soon as end of this month, and maybe vaccines available within the next month or 2. And our scientists are working tirelessly. We will not stop because science will bring our communities back to normal. And I want to thank the wonderful women legislators who make up this organization and whose leadership during this pandemic, before and will continue after, is so important. Pharma remains an ardent supporter, and some of the work that my colleague Courtney will talk to you about today incorporates not just our work on the pandemic, but the important issue around health equity and diversity in what our companies are doing. So with that said, I want to thank you all for this opportunity. And it is my pleasure to introduce one of my favorite colleagues that I get to work with in policy, Courtney. When Representative Scott said she had an energetic toddler, Avery is one of the most handsome, beautiful boys that I have seen. And he is, I don't know if he's going to make a surprise appearance, but if he does, we're in for a treat. And she does such an incredible job, not just as a professional at Pharma, but as a mom. And it's an honor to work with you, Courtney, and I thank you for your presentation today. Thank you all.
Well, Sharon, I don't think you're supposed to try to make me cry right before I do a presentation. But yes, I do have an energetic preschooler. I think you might have just got a little glimpse of him just now. I tried to bribe him with some Chick-fil-A for lunch, and he put ketchup on his sleeve, and the world just came to an end. So you might see an appearance from Avery. He's over his Zoom phobia, his Zoom fear of Zoom when we first started working from home, and now he wants everybody to see his newly snaggletooth smile. He's lost his 2 bottom teeth in the space of a week and a half, and the tooth fairy just doesn't do enough. Inflation is not enough. Let me share my screen with you all. I'm so happy to be here with you all today. Thank you for the invitation. Thank you, Sharon, for allowing me to come talk to this group that she talks very highly about within the office. She talks you all up all the time. And so I know that it's exciting for her to be able to have us share what we're doing at Pharma. Can everyone see my screen right now?
Yes. Yep.
Okay. Put it in the slideshow mode so nobody has to squint. So, you know, at Pharma, we really believe that our innovation that our companies provide is for everyone. We believe that everyone should have the opportunity to attain their highest level of health, and that we recognize that many communities and patient populations have a difficulty accessing healthcare and medicines that they need. It presents a challenge, especially in conjunction with other social determinants of health, you know, where we live, where we work, where our kids play, all of those things come into play when we're trying to solve for good health outcomes. What we know right now, what COVID-19 has really kind of underscored and highlighted in a really sort of grotesque way, is that there are many adults who are in fair or poor health status. And this data from the Kaiser Health Foundation is aggregate across all the states. So across all the states in the US, 18% of adults across racial strata, Asian, Pacific Islander, Native Hawaiians, Hispanics, Blacks, whites, 18% of us report that we're in poor health. And then there are stark differences across race. For Black people, there are 21.5% of us in poor health. Hispanics inches up a little bit more, 26%. And then the Native American population, which I thought was really kind of quite stunning when I dug into the data, at 28% reporting in fair or poor health. So we know that there are some gaps in healthcare access and quality of care, quite likely. In the same data, we see, you know, adults who report smoking and who report having asthma and obesity. And you can see here where the data aligns across the other racial strata. Smoking is quite high in certain communities. Asthma is quite high in certain communities, as well as obesity. Obesity is, you know, really bubbling up to the surface as the #1 driver of a lot of the chronic diseases that people have. Most people in the United States have one or more chronic diseases. And now with COVID-19, we've really seen the confluence of the pre-existing conditions folks have, the chronic conditions they have, and the impact that is had when they contract COVID-19. Again, chronic disease here, super high driver of cost of healthcare costs. Is estimated to cost $42 trillion between now in 2030. It accounts for 50% of our US healthcare spending. And we know that 191 million Americans have at least one chronic conditions. 75 million have 2 or more. There's a lot of work to be done on the prevention side. Again, the confluence of COVID-19 and these chronic conditions, we know a lot of older adults and people are living with chronic conditions. They're at higher risk for serious illness if they contract COVID-19. And so we know these are people that have heart disease and high blood pressure and blood disorders. Again, obesity as a driver, chronic kidney disease, chronic liver disease, compromised immune systems, lung diseases, the respiratory issues that we hear about folks having with COVID-19 are exacerbated if folks have a chronic respiratory disease, diabetes, and other disorders of the spinal cord system. What we see, COVID-19 is adversely impacting particularly Black Americans in the case rates, and the hospitalizations and death. And this has a little bit of a correlation with the percentage of uninsured Americans. So we've got to do a better job of making sure that people have access to insurance, whether it's a public health program or private insurance or employer-based insurance, so that they can get access to the care that they need. One thing that we're super proud of today is that we released the first ever industry-wide principle on clinical trial diversity. And this is important, namely because of the data that we see on this slide. We know that improving health and improving chronic conditions means increasing representation in clinical trials. And so you see the FDA drug trial snapshot here, and it reports, how many racial and ethnic groups participate in various clinical trials, and the data here is very low. And we know that this carries through to other clinical trials for, conditions that disproportionately impact Did I get muted? Am I unmuted? It said I'm muted by host. Am I still
All right,
talking?
you're good.
You're
Okay.
good.
It's popping up and saying you're muted by the host. And so some of these trials that are needed to be had to have more greater representation in, asthma trials and certain cancers that disproportionately affect Black and brown communities like multiple myeloma. We really have to increase our clinical trial representation here so that we can know that the medicines that our companies develop can actually work for the communities that we want them to work for. And so, as we've seen this confluence of COVID-19 and its impact on communities of color and the ongoing racial unrest that continues to just continues on in our country, over the summer, we heard a really clear directive from communities of color, and particularly Black and brown communities, about how they want our industry to show up. And we started thinking about how we can be better corporate sponsors too. And so we released a really bold statement that systemic racism is real as any disease and our industry is not immune, and that we really girded it in some racial justice principles. We're committing to open and honest conversations. We're committing to looking at what we can fill our talent pipeline so that every person from a community of color who wants to be a part of our industry can be part of it, can tap into our industry. Committing to being more diverse in our supplier and vendor spend. Committing to being more diverse and enhancing clinical trial diversity so that folks who want to participate can participate in it. And we're also talking about how we can move the needle on health inequity so that folks can achieve their optimal levels of health. As part of this equity initiative, as we're calling it now, it's brand new and nascent sort of program at Pharma. We have 3 pillars. We're looking at clinical trial diversity and health equity and talent. But I think for this group, we really wanted to hone in on the 2 probably most important pieces here, which is the clinical trial diversity piece and health equity, because I think that those are issues at the state level that all of you all are probably thinking about as you do your work. I grew up in Florida. My mom worked in the state legislature, so I grew up watching the inner workings of the Florida Senate, which is an interesting place to watch and to watch the process there. So I know that you all are wrestling with these sorts of policy issues every day in your work. And most particularly, I'm sure a lot of your constituents are trying to think about this vaccine, whether or not they're going to take it and whether or not they can be confident in the result. And so as part of this equity initiative focus, we're really thinking about this, the clinical trial diversity piece. How can we close the gap to make sure that our clinical trials better reflect the intended treatment population so that, again, the medicines work best for those communities? And then thinking about working with you all, policymakers, stakeholders, on policies that address the social determinants of health that I mentioned earlier, and really driving proactive research and policies to expand things like data collection. We saw there was a dearth of data collection early in COVID. Folks weren't accounting for race and gender and age in some of the early data collection. And now they are doing a better job of that, so it's helping to improve health outcomes on the back end. So how can we do that more broadly across the healthcare system? We again released today. I'm super proud of this, and we're all just in the building excited about it. It's our first ever industry-wide principle on clinical trial diversity. Our board approved this in October, and the chapter focuses on acknowledging, historic wrongs that have been that have affected communities of color. I think there's, still a large conversation about things like the Tuskegee experiment and Henrietta Lacks and other, medical mistreatment stories that get passed down, in oral tradition in our families and our cultures that resonate to this day. So really acknowledging those things and speaking to those with a finer point. And then talking about enhancing inclusiveness in trial design. So committing to adopt and promote appropriate policies that are scientifically driven, that contain patient-responsive study design, a target enrollment population, eligibility criteria, recruitment plans, so we can really dive into ensuring that we have the sorts of representation that we want to have in our clinical trials across our companies. And that this really sets the stage for our overarching effort. So you can find more information about our equity work and about these principles more broadly on our pharma.org equity website. I encourage you to go there and engage in the content. We've got a lot of good fact sheets and blogs and information from our CEO, Steve Ubel, on through folks throughout our building working and across our companies working on these issues. And then we also formed the Health Equity Roundtable at Pharma. And so this is where we're really kind of digging into what are the proactive policy solutions and agendas that we could set? What is the research that we could put our resources to? So participating in awareness of health inequities and the significant cost to our healthcare system and the effect that they have on patients and our communities as a whole. Working in partnerships excuse me, with groups like yours to support new and existing efforts to address systemic racism and systemic barriers to quality healthcare. And then supporting those solutions, again, that improve healthcare awareness and access and affordability that can improve outcomes in underserved communities. So when we think about what's next within pharma, when we're thinking about these issues, for us, I think what's next is continuing our research around promoting chronic disease prevention, because, you know, if you can get out in front of a diagnosis, you can save a lot in healthcare spending down the road. And you can, you know, further help someone improve their quality of life. And then if someone does have a chronic disease, really promoting adherence, really promoting the need to stick to a regime of taking your medicine so that other healthcare issues don't arise down the road that cause other issues. And then I think for you all, being thoughtful about, you know, addressing social determinants of health in the ways that you can in your respective state legislatures. You know, how can we ease transportation issues? How can we, you know, deal with things like environmental justice, pollution in our communities, all those things that make up that sort of wheelhouse of social determinants of health. And then being super strategic around leveraging state and county and federal and private resources. I know you all are in the trenches on this and you all have better thinking than I would ever have on it, but how do we press those levers where we can to be strategic and ensuring that everybody has equal access to care, especially, you know, in this time of COVID. We've got this, I keep calling it this imperfect storm of factors that are joining together to really point out and highlight where the gaps are across our healthcare continuum. And so with that, I'd love to hear what you all are thinking and have a back and forth conversation.
Great.
And I apologize that the preschooler is being energetic right now, so I will put myself on mute just so you don't hear him.
No, that is great. Thank you so much. That was a really, really great presentation. We did get some questions already in advance, even prior to the webinar. So I'll start that off, but please don't be shy. Please feel free to go, everyone in the chat, and pose a question, or if you want to use the raise your hand function, or right now it's pretty quiet, so feel free, you can unmute yourself and we can get you involved. We've got a bit of time and I'd really love to take advantage. We've got someone who's really helpful. So one question we did get on our previous call in advance of this webinar, which you did sort of address at the beginning, was the Native American populations. We saw the disparities in regards to how they are impacted by COVID, but are they also reflected in the clinical trials, or have they been featured? Not sure about that. Oh, are you muted again?
Yeah, I'm having a little bit of
technical
difficulties.
All right, there you are.
All kinds of interesting things today. You're right. You know, the same issue exists in the Native American community of underrepresentation in clinical trials. I've seen an article published even this year where maybe 64% of our companies don't have clinical trial representation of Native Americans. And so, and it's not for want of them wanting to participate. It's just, we have to do a better job of outreach and reaching out into those communities and making it easier for people to be able to participate in clinical trials. I think one thing that's an obstacle sometimes to clinical trial participation is that, you know, folks may have to take off work. So that's lost time at work, lost wages, perhaps. You know, are they able to travel to a clinical trial site? And so one of the things that we're going to be working on as part of this equity initiative is thinking through those sort of logistical issues. How can we be more helpful in having making it easier for people to participate. We should have a clinical trial site at a certain community, center right in the heart of the community so that they can access it, be able to, travel easily. Those are the sort of logistical things that people don't think about. There's the science of clinical trials. There's also just kind of the brass tacks of where's it going to be held? How many people are you going to have? Can people access it easily? Where do they sign up? So we're really thinking through as an industry, how do we make those things more accessible, readily accessible to folks so that they can feel like they can participate and have ownership, some sort of ownership in the types of health outcomes for themselves and their families by participating.
No, that's really great. So I see a question from Representative Subek from Wisconsin, and I'll actually ask you to unmute if you can pose the question, and just to see another face here, that would be great, or just hear your voice.
Sure, I'd be happy to. So I am wondering if there are things that we as legislators can do that would aid you as you try to make your clinical trials more diverse. Are there things that we can do, whether it's reaching out to our constituents in some way, or whether it's actually legislatively, any steps that we could take that you think would aid you in your work?
Okay, I froze for like 20, 30 seconds. But are there things, I think I heard you say, are there things that we can do legislatively?
Well, no, what I say is as legislators, so you have an audience that's a bunch of legislators, are there things that we can do to help you all as you work to reach more diversity in your clinical trials, whether that is legislatively, or are there things that we can do in the way of outreach to our constituents that might help you better connect? I'm thinking you talked about needing to be in locations within communities where you reach them. Are there things that we can do to help you do that, I guess, is what I'm asking.
I think there are lots of ways you can help us connect with your constituents. I think one thing that we have to overcome is this sort of a deficit in trust that I think I spoke to a little bit earlier. And I think that you all can be effective bridges in helping us bridge that gap in trust and helping connect us to trusted community voices, because you all have those relationships with all of those folks in the community that you all know are sort of the worker bees and sort of in the healthcare space, and really do the good jobs of connecting to people who need access to care and who do that hard work. So, helping us form those relationships, I think, is integral. I think to the extent that you all provide, any kind of assistance to minority serving institutions or other universities in your respective districts to increase, sciences, education efforts in the sciences, or specific schools of medicine. A lot of this work is being done at schools of medicine. Those are kind of tangible things that you all could do. I know the appropriations processes in every state is different, and the money is really tight this year. I can say, as someone who works on Medicaid, the Medicaid enrollment is going up, and that's a joint federal state program, and the states are going to start really feeling the squeeze in a minute. So the ways in which that we can find, to creatively work together to get the word out, it's all good if we can find those ways to do it together.
Great. We've got a few more great questions coming in. So I'm going to ask Eliza Munoz, and I'm sorry, I'm not sure of your title. It's hard with Zoom sometimes. But I just, if you could unmute and go ahead and ask your question, that'd be great.
Oh. Hi, everyone. So a pleasure to meet you all, and thank you for all the great work you're doing. So we were talking about representation or diversity in the beginning, and I just wanted to know that in regards to the Latino community, which has been a huge part lately when it comes to addressing particular needs in regards to healthcare, that if they are being accounted for and the other thing is it being divided? Like, it's, do you see a certain percent of Cubans, a certain percent of Mexicans, a certain percent of Puerto Ricans in regards to the participation of the work that you're doing?
Yeah, that's a great question. I think it actually folds nicely back into the previous question on what could we do, particularly probably legislatively, is encourage your departments of health to disaggregate that data, because to your point, sometimes we get the data and we see groups like, grouped all together, Hispanics, and we know that there's variation within that group, or we see Asians, lumped together, but there's a lot of, variation within that particular ethnic
Communities. Yeah.
community, right? There's a lot of variation. And so that's one thing that we want to really push too, is encouraging folks to ask for data collection that has better disaggregated data, so that we can really drill down on specific communities in a better way.
Right. Thank you.
And then we've got another question from ARG, again, with the Zoom titles. Not sure who you are, but you asked a great question, so I'd love to hear your voice. If you can unmute.
Sorry, there I am.
Oh, no worries.
I'm Councilman Rocha Garcia from the city of San Antonio, and thank you for your presentation. I tuned in a little bit late. I was having audio difficulty as well. I am faced with, we have a large percentage in San Antonio of folks who still don't speak English. A lot of them, by the way, are very afraid because they're undocumented, and so they already don't seek help. Most of the residents that I represent have underlying health conditions. 26% don't have healthcare insurance. And so a majority of them happen to be Hispanics of Mexican American or Mexican descent. And so my question, and I've been asking this question to the city staff, is how do we make things that resonate? Because direct translations don't just translate appropriately. And so there's this great idea for a campaign, but nobody runs it past someone, past the demographic that really needs to hear the message. And so I'm wondering if you've seen any studies. I'm also a professor of marketing. And so I have a student that's working on this type of research across the United States to see if there's any communities that are doing an exceptionally well job at communicating with their different audiences. Have you seen anything like this across the United States?
Yeah, I think that's an issue that everybody struggles with, right? How to communicate, how to talk to people where they are, meet people where they are, and talk to them in a way that the information that you want to convey is accurately done. So I think a lot of that comes down to like really culturally competent materials, the development of those types of things, plugging into trusted community voices. I think one thing that we heard a lot when we were starting to put together this equity initiative at Pharma, and we did a lot of focus group talking with Black and Brown communities, Hispanic communities as well, is, what is it that you want to see from us? And I think you spoke to it just a little bit there in what you said. And they said, don't come tell us what the solution is, work with us together. So that means work with us together to partner with us to find the doctors that are willing to work with communities, maybe undocumented, persons who need that extra help. Help us develop the materials that will resonate, that are culturally competent, that will make people say, I really need to go in and get myself, checked out, and then connect them into a community of partners who will kind of follow them through their process. A lot of people, get intimidated by healthcare, and it's particularly so if they're undocumented, they're just afraid. For a number of reasons at this particular moment in time. But when people have support and they are kind of cared for throughout the entire process, it makes people easier. It makes it easier for people to stay engaged and up to date on their own healthcare. So I think all of those things come together I think, to achieve what it is I think you're asking for, but it's a lot of hard work on the front end because you have to make those connections in the community to make people feel safe to be able to engage and take care of their healthcare needs.
And I love what you mentioned about, so influencers, if you will, right? And I had a conversation with the Consul General of Mexico. Again, we have a large population here from Mexico. And so he said the same thing. He said our folks need to see that something is, devastating, or how did he say? He said, use, the worst case scenario type. And so I've lived through this firsthand. A lot of the folks that I represent have been affected. We have some of the highest 14.2% of the deaths in San Antonio are from my district alone. It's very unfortunate. I've also had 7 family members who passed away from COVID. They all had underlying health conditions. Additionally, I've had 3 church family members. So I see the numbers, and I'm figuring out, how do we best communicate with folks who continue to get COVID, because they also happen to continue to be the essential workers that are getting COVID. And so I had difficult time conveying that here in San Antonio, that we need to really hone in on the messaging strategy for the different groups, because they're the ones that are out there working on our behalf every single day. And so even if some of my colleagues that are online have any ideas or what they've done in their communities, maybe if you all could share with me in the chat box, I'd love to see some resources. But thank you so much for the presentation. It was very helpful, and I appreciate you for your time. Thank you.
Thank you.
Great, and we did get one more question prior to the event as well. And this is sort of more about not racial diversity, but age diversity in clinical trials. And as the mother of a also active preschooler or almost preschooler, in relation to COVID, I know people are wondering, at what age are they thinking, how young can kids take the vaccine, or is that the next phase, or I don't know what the proper question is there.
Yeah, I think that's probably the next phase. I think, our as our companies.
All right, are you back? I'm not sure what happened there. You're muted, but I don't know why.
Okay, am I back?
Okay, you're back. Sorry,
There's gremlins in the system.
I don't know.
Yeah, I think that's probably the next step, right? We want to make sure that, our companies, as they're following the science, they want to make sure that the vaccine that, is derived works well in adults first. And then I think probably, what will follow is looking more closely at how the vaccine could work and how it react in children. And, it's a very sensitive subject. I've got a 5-year-old, and I'm not entirely sure myself, even though I work for pharma, I'm not entirely sure myself, do I vaccinate my son? And so I think there are a lot of those questions that are floating around. And I think we'll know more as we know more about how this vaccine works in adults, and be able to kind of translate some of that information to how we think it might work in children.
Great, thank you. All right, I'm not seeing any more questions unless someone's got something burning that we have I've looked over in the chat. Please feel free to use that hand function. But if not, I'll turn it over to Representative Scott to close us out, and thank you so much, Courtney, for your time, and what I thought was a really great presentation.
No problem. Thank you for having me. I'm happy to come back anytime and be a resource and a listening ear and be helpful.
Well, thank you for joining us today. I'm always pleased to have pharma as a resource, and I'm glad that you have had this opportunity to connect with. We're glad we had this opportunity to connect with you, Courtney. Please feel free to reach out to us at NFWL for any questions or comments from following this event. NFWL is posting all of the materials to their website, and will follow up with an email with links to all the resources mentioned on this call. I hope you all are staying safe, and I look forward to connecting digitally again in the future. And again, thank you, Courtney, and thank you for coming on board with Farmer today.
All right, everyone. Thank you so much.
Ladies. Thank you so
Thanks,
much.
everyone.
Thank you, everyone. We appreciate
Excellent content. Thank
Yes.
you.
Thank you all.
Aloha,
Stay
everyone.
safe.
Thank you.
Happy
Aloha,
holiday.
Senator
Aloha.
Kim.
Bye.
Bye. It was great.
Bye, everyone. We end this.